Irritable bowel syndrome is, as the word points to it, it's a syndrome, is a composite of complaints that patients have that affect the GI tract. It's not something that we can immediately say it's caused by an infection, it's caused by a structural change in the bowel. So therefore, the physician who evaluates a patient with an irritable bowel, IBS syndrome, has to pay attention to the types of symptoms, when they occur, how frequent is their trigger factor, has to evaluate his patient for the possibility of other conditions. And that's where we bring in the criteria of, or the characters of what we call red flags. So an irritable bowel syndrome is a combination of symptoms that the patient mentions to the treating, evaluating physician that consists of either pain with or without a change in bowel habit, such as diarrhea, constipation, or a variable pattern, a mixture of both diarrhea, constipation, with bloating, with a change in the shape, consistency of the stools. They could be loose, they could be hard, they could be like little fragments. But above all, the irritable bowel does not have the red flags that I mentioned previously. That is the presence of bleeding, very significant, relevant weight loss in a short period of time, no fever, no vomiting. Once we consider the red flags, and if they're not present in the patient, there are other lab results that we can request to evaluate the patient and exclude something that may be caused by another illness other than the IBS, the irritable bowel. If a physician requests those labs, they're not specific. There's no specific blood test to make the diagnosis of an irritable bowel. So what one does, one looks at the lab for help to see if there's anemia, evidence of bleeding indirectly or directly, a low red cell count with a low iron or something called ferritin, signs of inflammation in the blood. We request a test called a SED rate or CRP that indirectly look at this aspect. And other tests, make sure there's no low protein to suggest a difficulty with a difficult absorption, nutrition, which is not really a main issue when one deals with irritable bowel. So once the red flags are excluded and the physician's certain about that, he or she can then say, well, I'm not yet sure. I need to evaluate my patient further. And that can be done with x-rays such as a CAT scan, x-ray of the small intestine, a barium enema sometimes, or proceed to something more specific and definitive, yet somewhat invasive, called a colonoscopy, where you look at the lining of the colon, you can take samples and make sure there's no inflammation. The bottom line is to make sure that there is no colitis, because colitis is treated differently. It's somewhat of a greater concern to some patients because it could lead to serious consequences and disabilities. So it's important not to attach the diagnosis of IBS, irritable bowel, to someone who may have something that can be treated differently and therefore modify their quality of life and outcome. I think that more or less summarizes what I've been trying to convey about what IBS, irritable bowel syndrome, is and how to proceed with a detailed, specific evaluation of this condition.